So welcome everyone. Thank you to this third in our webinar series on all things Buckinghamshire, and the topic today is our healthy ageing population and how we can help people, residents in Buckinghamshire, to age well. So without further ado, I will introduce our speakers. So I'm really pleased today to welcome Mark and Helen from Age UK Bucks, who will be talking about the work that they're doing with their charity in the local community. Lucie Smith, who's a public health principal from Buckinghamshire Council, and Lucie will be looking at giving an overview of the county population and talking about all the age-friendly work being done by the council. And finally, we'll be lucky enough to hear from Dr. Chris Foote, who is the project coordinator at Chiltern Compass, and he'll be talking a little bit about the work that Chiltern Compass do. So without further ado then, I'd love to hand over to Mark and Helen at Age UK for the first presentation. Thank you.
Thanks so much, Henry, and lovely to see everybody. And I'm just going to share the screen, so bear with me for a very short while we hop on to screen share. Sorry, one sec. Okay, can everybody see that screen okay?
Yep, all good.
Lovely. My name is Mark Russell. I'm Chief Executive of Age UK Buckinghamshire. I'm joined by Helen Wain, our Head of Community Services.
Good morning, everyone.
Our presentation this morning is about insight into old people in Buckinghamshire through our work, our staff, our volunteers, and our beneficiaries.
Is there somebody is somebody having problems? There's a hand up.
I think it's gone down.
All right.
And obviously we were delighted to support the Bucks Uncovered report that Heart of Bucks recently published. We're a completely independent charity, and when I say that, independent from Age UK National or Age UK International. We've got 36 staff, the vast majority of whom are part-time, working on frontline services with older people, and we have 200 volunteers. So in terms of Buckinghamshire's sort of volunteer base, that's a substantial sort of sized organisation, although obviously we'd like it to be larger, to do more work for people. All our work is in Buckinghamshire, and our funding is largely generated from Bucks Commission services and donations from local funders and the public, including some of the organisations represented today. So thank you for your support. We also work with some age concern friends. So these are age concerns that didn't unite into Age UK when it was rebranded and consolidated back in 2009. And they offer lunch clubs, cafes, transport, walking groups and day centres across the county. And there are some other independent age concerns which you might be aware of. For example, there's a strong one in Buckinghamshire, and we do support all of those where we can. We wanted to give you a little bit of information about what we do and how we support older people. And we directly support around 4,000 older people in Bucks a year. And just so that you know, and Lucie will come on to talk about this in more detail, that's there are about over 105,000 over 65s in Buckinghamshire. Our services are largely aimed at supporting the overall health and well-being of older people, recognising the wider determinants that impact health, and can support and empower older people to maintain their hard-fought-for independence in their own home. That actually means that a lot of our services are in-home and lead to longer-term relationship building with older people. That's probably much harder to deliver. It's more expensive to support, but it's critical for people for whom transport, communications, and mobility can be an issue to accessing services and support. We're just going to run through the services. Helen's going to do that for us, but I wanted to just touch on the needs that we're addressing. The first one there is signposting and knowledge. We also have a significant body of services aimed at loneliness and isolation. Of course, older adults, excuse me, that live at home on their own can suffer from isolation significantly. We focus on standards of living and supporting maximising older people's income through benefits, and also, as I said, independence in the home and making sure people can stay independent in the home for as long as possible. All of those are interlinked and do support the health and well-being overall of older people in the county. I'm going to hand over now to Helen to talk through some of our services.
Lovely. Hello, everyone. So yeah, just looking at that sort of cog there, thinking about that first area, so signposting and knowledge. Obviously, that underruns all our services, but most importantly, our information and advice service, which is also sometimes referred to as our first contact team. And that really is our front door service. So it's delivered by a small group of staff, and it's mainly telephone and email based. We run it every weekday morning between 9:30 and 1:30. And we get between 150, 200 calls per month on that service. And we get a wide range of inquiries. So very common inquiries around accessing social care services, how to look at more social activity, benefits, wills, power of attorney. But we also do get some ones from left field sometimes that makes us think on our feet. As I say, it's a gateway to our services, so we can sometimes refer into some of the other services I'll talk about in a minute, but also we refer and signpost to other services outside of Age UK Buckinghamshire. So a lot of the time we will signpost to carer support services, dementia support services, local authority social care, as well as an awful lot of voluntary sector and local facilities that are there to support older people. So we've included a little case study to demonstrate the value of our services throughout this sort of slide deck. This is a very common one. So it was a gentleman that really was very concerned about his electricity bill, but was having problems accessing the supplier. He had hearing loss, which age-related hearing loss is very common. As we do age, our hearing does deteriorate. And so phone calls for him wasn't very an easy thing to do. And really, this is the value of information and advice. We were able to, via a letter of authority, contact the supplier directly, set up a face-to-face meeting with the client, and the issue was resolved, which was brilliant. There was an issue with his meter, but that just shows how that older person not being able to contact the person they needed to at source created such a lot of anxiety and concern for them. So moving on now onto the next cog, loneliness and isolation. This is really where our Befriending Plus and Boost services come in. So our Befriending Plus service is a very long established service for Age UK Buckinghamshire and really exists to combat the loneliness and isolation lots of older people feel and continue to feel post-COVID. There is still a lot of lack of confidence. We hear that an awful lot from some of our older clients around re-engaging back in the community again, getting out and about, inviting people even into their own homes. So that isolation is still a huge factor that we hear about an awful lot. And of course, you will know that being lonely, experiencing that isolation impacts on lots of areas of our lives. So not just our mental, psychological well-being, but the way we think, our cognitive health, that will lead to, lack of confidence in communication, which means people can stop communicating and become very insular. And then, of course, the less you do, the less you feel able to do, which then impacts on our physical health. So our befriending service, really, we're very lucky to have 175 volunteers on that service. And they really focus on providing a weekly contact with an isolated older person in the person's own home, mostly. And that's a huge thing for that client. It's a very high touch service. So as Mark said, it's a very it's quite an expensive service to run, even though it's all run by volunteers. We support and we train those volunteers, and the support is ongoing. We always run a waiting list for befriending, unfortunately. We have over 300 people on our books for befriending, so to speak, but 100 of those people are on the waiting list currently, and it always hovers at around 100 on that waiting list, which is very difficult to manage when that need is there. Obviously, the aim of the service is to tackle that loneliness, but as you'll appreciate, as the relationship with the volunteer deepens and grows, they look at other issues with that older person. So if the older person is struggling to get to health appointments, if they are struggling to get hold of the energy supplier, If they're struggling with their shopping, sometimes a volunteer can help with that as well, as that relationship deepens. And some of our matches have been going on for some years, which is brilliant. So that's our befriending service. And then we've got our Boost service, which is relatively new. It started in October, and this sits under our befriending umbrella, but the focus is slightly different in that it's for those older people in Bucks who do experience that isolation, but who are wanting to get out a bit more and reconnect in the local community. So they're wanting to take that step forward. And our members of the team and our volunteers can help that client see what's around that they may want to take part in, look at that transport option, how they can get there, do that journey, do that intervention with them, alongside them a few times until they're confident. But the aim of that service is that it's short term. So within 6 months, we aim to then move away and let that person get on with that activity and with that reconnection. So it's self-sustaining once that we have finished our intervention with them. And again, just a very common really case study of somebody who actually was supported through COVID on the telephone, who was referred to our befriending service, had a huge interest in music, was used to being very social when his wife was alive, but unfortunately she had passed away. When we were able to start going out again, it did become apparent that there was an issue with hoarding in the gentleman's property, which again is quite common. And we worked with him to access some support and make his environment more comfortable for him. And as that bottom line there says, almost 2 years later, that match is still going on. That relationship continues to flourish, and they've even been to music recitals, which is lovely, outcome. Looking at the standard of living cog, then this is where we really think about our welfare benefits service. So this is a service that we have 2 members of the team sort of coordinating, and we have a brilliant team of 18 volunteers. So there is an awful lot of government benefits that go unclaimed every year. I'm just looking at this stat here, which is across the country, there's £2.4 billion of pension credit, which is unclaimed every year. And so part of our aim on the welfare benefits service is to really get that knowledge out there to older people and their carers, that these benefits are out there for people to claim. And we don't just do that, we support them to claim that. So our volunteers will go out again into the person's own home. They will fill in the benefit claim form alongside the older person and the carer, and we then send that off to the Department of Work and Pensions and track whether that has been successful or not. We very typically help with attendance allowance, which is a sort of 39 page form asking very personal questions. We also help with personal independence payment, pension credit and carers allowance. And we have alternative office status with the Department of Work and Pensions. And that really means that our staff and our volunteers are nominated agents, which means they can verify documents without the client having to send them off in the post. And we also have access to the claim forms here in the office, so we can take those with us when we go out and see the client. So brilliantly, this last financial year, we helped claim £1.6 million of benefits for older people in Bucks with that very small group of volunteers. And obviously with the cost of living squeeze, which we're all experiencing at the moment, this is much more important. And this is an area that we are expanding as well with another member of the team, which is brilliant. And again, this demonstrates this little case study here, not just that we were able to help people with an attendance allowance application and that it was successful, but that sometimes we support people at a time of crisis and change. So this was a son that referred his mum, who was starting on a dementia journey there, and went from Mr. H there at the bottom is brilliant. And it really shows that if we can provide that support at the right time, at a time really of change and uncertainty, it just provides that reassurance. And, as he said, they're helping navigate the first steps of organising a different life for that client. So that's really important to demonstrate. And then finally, the independence at home cog. So we have a number of services here. So we have our hospital discharge and support service, which we've been running since just over a year, which really provides support home from 2 hospitals, so that's Stoke Mandeville and Wexham Park Hospital. This is a local authority contract, and we help people get home from hospital, settle them in at home, make sure the heating's on, the milk's in the fridge, you know, they've got enough food for a couple of meals. And then we can also pass on to our community support area of this service, which is where we can provide up to 6 weeks very practically based support for people whilst they get back on their feet. So practical support as in shopping, a little bit of housework, collecting prescriptions, very targeted at the support at the right time whilst the person is able to regain that independence. We have a range of home services, again, very practically based, such as housekeeping, toenail cutting, hairdressing, gardening. That is delivered by self-employed agents to whom we refer our clients. And those agents we vet and we make sure they are DBS checked as well. And that provides just that right level of support to enable people to maintain their environment, to maintain their independence in a safe and monitored way. And finally, in the middle there's our walking football, which we are delivering in conjunction with Wycombe Wanderers at the moment. And that's a brilliant group there, just getting some activity and some camaraderie going on with those groups of older people. Again, a very short case study demonstrating the value of those sort of home services, that very practical support. And this was around us fitting a key safe for somebody that was starting to forget their keys when they went out and they didn't have family locally. And the quote there from the carer, I think, is brilliant, because although it's a very sort of easy fix, putting a key safe up, the value of that, having somebody trusted to carry out that intervention, and then knowing that not just the older person can maintain that independence and safety, but that the carer can have that level of reassurance. I think that really demonstrates that very clearly.
Thank you so much, Helen. Willing to take questions later on about any of those services for you. Just one other area of work that we do, which is really about ensuring older people have a platform for amplifying their voices, highlighting needs and championing older people, I think, in our community. And here's just a selection of the boards, partnerships, workshops that we sit on and have been invited to, where we can do that. There's a really strong VCSE partnership board working with the council. There's obviously the new Bob ICS Health and Wellbeing partnership, a whole host of different forums that we support and try and represent older people's views in. And I suppose one of the ones I wanted to highlight really are listed here. I think Lucie's going to come on and talk about the age-friendly approach with Bucks Council's health and wellbeing strategy for ageing well. The Healthy Ageing Collaborative is important to highlight. That's a collaborative of organisations. It's fairly new. Organisations and agencies led by Bucks Council Public Health and co-chaired by Age UK Buckinghamshire, by myself, with Stephanie and Lucie, to build a county-wide focus on ways to improve emotional, social, cognitive and mental well-being for older people, especially thinking about the lack of social contact through the pandemic. Together, we're building knowledge and awareness, a network of interested parties. We share news and information via a newsletter about older people and insight into them. And we aim to find innovative pilots and projects in Buckinghamshire based on the collaborative's group knowledge and expertise to focus on improving self-reported well-being, increase social connectedness, and to reduce isolation and loneliness. I've also ringed their partnership and collaboration, which is something we're increasingly doing. We're part of a 6-charity sort of coalition collaboration called Charities Together, which is supporting, again, some funding which has been convened by Heart of Bucks, looking at supporting and alleviating poverty across the county, and with specific reference to Aylesbury, Wycombe and Chesham. Our work with Wycombe Wanderers Foundation, the Listen, Learn, Adapt work, which some of you funded, and lots of other initiatives across the sector in Buckinghamshire. I also wanted to do a little bit of flag waving. You did some of this in your report, but I didn't want to lose the opportunity to make sure everybody understood the huge contribution older people make to our communities. Overall in the UK, the economic value of employment, informal care, childcare and volunteering carried out by the over 50s totals nearly £800 billion a year in terms of value. In terms of the workplace and employment, a quarter of the Bucks workforce is over 55, and the average age of a UK councillor is actually 60 years old. In terms of caring, 38% of older people in England receive help and care they need from family and friends, which is informal caring. And according to Carers Bucks, there are 52,000 carers in Buckinghamshire, over half of whom will be over 55. In terms of volunteering, 1 in 6 older adults volunteer at least once a week, and those most likely to volunteer are between the ages of 65 and 69. And then childminding is another huge area where the nation's grandparents, 2/5 of them, provide regular childcare for their grandchildren, often enabling their parents to work. We're going to touch on some challenges now and some issues. I'm sure Lucie will pick up on these. But first of all, talking about the bigger picture, what we're seeing, hearing and experiencing around the challenges older people are facing at the moment. The first one, which Helen's touched on, is the shadow of COVID. Older people are not bouncing back like perhaps some of the other rest of the population. And issues like deteriorating health and health deconditioning are very real issues. And 1 in 5 older people said their health in a survey in 2022 had got worse over the previous 6 months, with more than half of older people not confident that their health would improve. And during the COVID pandemic, Public Health England published a report showing that physical activity in the 70 to 75-year-old bracket had decreased by as much as 50%. Those are really real issues that we're seeing and experiencing in the contact we have with older people. In terms of social confidence, Helen's touched on this in terms of our Boost service. Again, that Age UK report from 2022 showed that only 50% of older people felt confident using public transport. A third were confident using leisure facilities, and only 35% were keen on going to group classes and activities. Nearly 40% of over 65s in Bucks live alone, adding to that tendency for isolation and loneliness. And overall in the UK, the percentage of adults who feel lonely often, always, or some of the time is nearly 20%. Cost of living, obviously that's a very key and live topic for all of us at the moment. But what we're seeing is that the cost of living is having a specific impact on older adults' ability to care for themselves, to afford caring, and to maintain their quality of life. I think Helen can probably speak more eloquently than me on the experience we're seeing of adults who feel that their continuity of care from other agencies has really been impacted over the last few years. And I know from the report that Heart of Bucks have done recently around the inequalities and obviously Opportunity Bucks more generally, led by the council, there are significant inequalities that we still feel and see both in the rural parts of the county and in our urban centres. Helen, I'm going to move back to you now to talk about some of the everyday challenges that we're experiencing.
Yeah, so just really quickly, we'll pick up on a few of these, which are echoing the last slide, really. But we are hearing from our older people that there's issue in all of these and more. Increasingly, we are talking to people and having referrals for people across all our services who have more complex needs. And that may be that, we are living longer, but we're not always living well longer. It also ties into access to services. So certainly through COVID and still now, people may have delayed getting medical advice and intervention, which has impacted, unfortunately, on their mental and their physical health, which makes their needs more complex. And again, those living situations, so issues around housing, hoarding, safeguarding, we are seeing an awful lot of that complexity come through to us now at Age UK Buckinghamshire. Money worries, I think we've covered really, but we are seeing, recently on Information and Advice the other day, somebody that basically said, I'm having spaghetti hoops every night for my tea because I've got a huge rent bill, rent arrears, and I don't know where it's come from. We are seeing a lot more of that. Access to transport. Those of you that know Bucks well will know that that is a big issue, and it's something we've come across on our Boost service. So whilst we are there to help encourage our clients to access community resource and to access social intervention outside of the home, sometimes, unfortunately, the transport systems are not there to support that. Just a little bit about the low-level advocacy before we move on. So when we talk about low-level advocacy, it's that ability, I think, to have a service whereby we can sit with the older person, go out and see that client in their own home, talk to them about what their issue is, where they feel they're not being heard, where they're not being listened to, and work alongside them to progress that. And that might mean being able to access the right people. It might mean speaking in the language that the older person understands, rather than sometimes a lot of jargon. And that we come across an awful lot in our services, people being unable or feeling unable to progress the issues that are stopping them maintaining their independence or their well-being, and they just don't feel they're being heard. And unfortunately, as far as I'm aware, in Buckinghamshire, there's nowhere that we can signpost or refer for that to.
Okay.
Yeah.
I think timing-wise, I'm going to skip a heartwarming and quite sad poem that we were going to play for you, but we'll maybe supply that with the presentation when it's shared. That was a book of poetry that was brilliantly put together by our volunteers from a befriender that an older person that we were supporting through the befriending service, which we'll share later on. In terms of gaps in service and provision, I'm going to skip through these quite quickly because we've covered some of them. But overall, we've got a capacity issue. We've got waiting lists across all our services, which Helen's already touched on. And we'd like greater geographical coverage across Bucks, and particularly the rural north and some of our more deprived areas. We'd like more volunteer representation in those areas. We'd love to look at information and advice being able to be supported across the daytime period, not just up until 1:30 each day. Digital inclusion is a constant theme, which we have limited service provision for at the moment. Helen's mentioned low-level advocacy and the issue of supporting people and carers with dementia. A final couple of charts, very briefly. Where are we going? Current solutions in the future for us and our support of older people. On the left-hand side of this chart, you'll see there's areas where we want to sustain service and protect service. I must say, under increasing financial pressure, rising costs, we have a significant deficit we're running at the moment, which is managed. But some of the grants that we get in to run services do not cover the cost of the services we're running, and yet we still have waiting lists. So those areas of befriending, information, advice, and home services. We are expanding and looking to expand our welfare benefits service, which has had funding from some of you on the call. So thank you very much for that. And we're also looking to introduce a paid-for home services appointments this year to help people who are really feeling the cost of living crisis. And we want to be expanding and being more present in those opportunity bucks, wards and areas across the county. In terms of innovation and piloting new ideas, we want to look at developing our hospital discharge support service to think about working with the local authority and the NHS on frailty issues and reconditioning once people return from hospital visits. And something which is a bit of a bigger idea is a thing called intrinsic capacity, which is a World Health Organization term around the resilience and core strength of older people, and how we can work with our cohort of older adults and our befriendees to help strengthen an individual's intrinsic capacity and remain independent for longer. And then finally, in terms of growth and development, we're looking for more partnerships and collaboration across the sector and with agencies. We want to do more community engagement, particularly engaging with our volunteers, our supporter base, our donors, and other organisations. And we'll be looking to build more co-production opportunities, particularly with older adults. And as a final chart, always wheel out Mark Twain. He has many quotes. Age is an issue of mind over matter. If you don't mind, it doesn't matter. I don't agree with that particularly, but actually as a point of reference to reframing how we think about age, I think that's something we're hoping to work with partners across Bucks on in the future, and we certainly look forward to working with Bucks Council and other agencies on making us an age-friendly place in the future. Thanks very much for listening, and I'll shut up now and we'll pass over back to Henry.
Great stuff. Thank you, Mark. Thank you, Helen. Really insightful. I particularly like the slide on the contribution that older people make to the county, and 800 billion to the UK in terms of economic contribution is a very big number. So thank you very much. Without pausing for questions, which we'll take at the end, if you do have questions for Helen, please drop them in the chat, and we'll do a brief Q&A at the end. But I will hand over immediately to Lucie Smith, Public Health Principal at Buckinghamshire Council, for the next presentation. Thank you, Lucie.
Thank you. Okay, so I'm just going to share my screen, get my slides up. So hopefully you should be able to see that. Yeah. Okay, so I'm going to be talking to you today then about the work that we're doing within the public health team to look at our age-friendly work. So I'm going to talk to you briefly about the data. So what does that tell us? What do we actually mean when we're talking about healthy ageing, age-friendly, and then give you an overview of the things that we're actually doing. So this is our data about the Buckinghamshire population. I won't go into it in too much detail. You can have a look at the slides when you get them. But we know that over the next 20 years, we are going to have an increase in our older adult population. So 33% increase in those 65 and over, and 66% increase in 85 and over. And as Mark and Helen have already touched on, across Buckinghamshire, there are inequalities. So this slide shows that a female living in Aylesbury North West Ward is going to have a life expectancy of approximately 80, but that will increase for a woman living in sort of Hadnam and the Villages Ward to shy of 90, and similar for men as well. So lower life expectancy for men in sort of the Booker, Creswicks, Castlefield area of High Wycombe compared to those living in Gerrards Cross. So there are inequalities that exist across our county. And again, Mark and Helen have touched on the impact of COVID. So we know that physical activity rates have reduced, particularly what we call our strength and balance activity, which from a public health point of view, health and well-being, we know strength and balance is really important to reduce the risk of falls as we age. We know that loneliness has increased, and this is against a backdrop of a rise in one-person households as well. And we also know that employment within older adults has also fallen because of the pandemic. And again, we know that actually older adults are a huge contributor of our workforce, but also, you know, contributors in terms of volunteer sector as well. So one of the risks is when we look at our public health data, it's all quite negative. And that often will lead us to think about our older adults with particular stereotypes. So quite often when we're talking to partners and, you know, individuals, we've got the classic image of sort of the wrinkly hands. You know, we talk about an older population and therefore the increased demand on our NHS. You know, the issue of bed blockers because we can't get people out of hospital into their own homes for various reasons. And so sometimes the narrative and the conversation that we can have around older people can be quite negative, and it can be quite stereotypical. Now, I'm not saying that there aren't a cohort of our population that, you know, we've heard about the great work of Age UK and all of the support that they do. You know, there will be that cohort. But when we're talking from a healthy ageing point of view in public health, we're talking about how can we support people to age well. How can we support people to live healthy and fulfilling lives, that they can continue to participate in the activities, contribute to those communities, that they live in suitable homes so that they can remain in their home as, you know, living as independently for as long as possible, that they're financially secure, and that they live in flourishing communities. And so the work that we do in public health is much further downstream. So, for example, if we're thinking about employment and retiring, we don't start to plan our retirement a week before whatever the retirement age is. You know, that starts hopefully happening a lot sooner. And the same with our health and well-being. We need to start thinking about healthy behaviours a lot sooner. So in Buckinghamshire, we're working towards becoming age friendly. And so it's about how can we develop those communities that with the right policies, the right environments and support, we can enable people to live healthy, active and independent lives. And the way that we're doing that is by drawing on the WHO's age-friendly communities framework. So for example, the image on this slide, this is actually my dad. He's 71. He's just about to go whizzing round on his classic motorbike on one of his very many track days that he does. He's not, you know, the most fittest of individuals. He's got every CVD condition known to us. He's overweight, but he is financially able to continue to participate in the activities that he enjoys. He lives in, you know, a home that has got a garage where he can store all of this stuff. You know, and he participates, and hopefully, even though my mum and me keep wanting him to stop, but hopefully he'll continue to do this for as long as he possibly can. So the work that we're involved in is enabling more individuals, you know, to age well and to continue doing what they want to do. So very quickly, this is what the WHO age-friendly communities framework is about. The framework has identified 8 elements which, if they take place in communities, it enables people to age well. So the elements that they've identified are around outdoor spaces and buildings. So again, you know, having pavements that people can walk down, having warm spaces, for example, transport we've heard about, housing, how can people live in those homes for as long as possible, participating in society, we've heard a lot from Age UK about that, volunteering and employment, helping people to retire well, communication, so breaking down some of those stereotypes and that stigma, but also having the right information at the right time for people and their families and support, and also some of that community support to support health and well-being. And running through all of those areas is respect and social inclusion. So we know that, you know, one size model isn't going to fit everybody. My dad is not going to want to go to a knit and natter group at the library, for example. We need to make sure that what we're delivering is culturally competent for all of our older people within the county. So what are we actually doing? We are developing an overarching healthy ageing strategy that sets out our commitment to be age-friendly Buckinghamshire, and to be more age-friendly. We know there's lots of things that are already happening to support us to age well. In order to support us in that journey, we've joined the UK network of age-friendly communities, and we've had really positive feedback from that network about the foundations that we're putting in place to build our piece of work. We are about to start on a really big insight gathering programme. So again, you know, Mark and Helen have touched on some of it, but actually, what does it mean to age well for our population in Buckinghamshire? What helps us to age well? What's not helping us to age well? And then in turn, how can we take that insight to inform our actions and our projects and our pieces of work? And we also want to look at how we can develop some community researchers as well to help us with this work. And also how can we develop some age-friendly communications to really showcase ageing well in Buckinghamshire, and to address some of those stereotypes and that stigma around ageing well. And then we've also got an array of different programs and interventions as well. So we've got a variety of different groups and partnerships. So we've already mentioned the Age Friendly Partnership, which is chaired by our deputy leader, Angela McPherson at the council, and that oversees the implementation of our age-friendly strategy, and that brings together a range of senior partners from those 7 elements that the World Health Organization have identified, and they'll be driving forward the strategy and also the underpinning action plan. We've got the Healthy Ageing Collaborative that Mark's already focused on. And then we've got a whole number of other groups and partnerships that look at different areas. So, for example, we've got the Live Longer Better Alliance that's looking at the physical health of older adults as well. And then we've got a range of different projects. So we've got our Healthy Libraries framework that we're working with our library colleagues on. That takes a start well, live well, age well approach. So some of our libraries have been delivering activities that support dementia, that bring people together through social activities. We've got our Health Equity Fund that we are running in partnership with Heart of Bucks, supporting ethnic minority communities to deliver projects and interventions that address the inequalities that they've identified. And then we've got a range of other projects as well that these ones mentioned on this slide mainly look at the sort of physical activity slide, but we'll also be bringing people together as well, so offers social opportunities. But we've also got things around our cardiovascular disease work stream as well. And the one thing that I will say is when we're looking at healthy ageing, we start looking at healthy ageing from 40 plus. So we're not waiting for people to get to 65. We're looking at 40 plus. And that really gives us an opportunity by taking that age range to really start working with our partners to get healthy ageing on our partners' agendas, and to also make sure that it's a shared responsibility, because we've all got a role to play in supporting our residents to age well. So that's a real whistle-stop tour of all what we're doing within public health and with our partners. So I'll leave it there, but happy to pick up questions.
Great stuff. Thank you, Lucie. That's really really helpful and very, very efficient use of time as well. Thank you. But yes, if you have questions, again, please pop them in the chat function and I'll pick them up at the end. I'd now like to introduce Dr. Chris Foote, who's the project coordinator at Chiltern Compass, who is going to talk to us a little bit about the work that Chiltern Compass do to support the sort of concept of healthy ageing in Buckinghamshire. So, Chris, welcome, and over to you.
Thank you. Can you see me all right? And I'm moving, okay. Daniel's going to put some slides up for me. Thank you very much. I enjoyed those 2 presentations very much. They were extraordinarily useful. Thank you. But the one thing you'll notice about both of them is that though they talked about old age, they didn't talk about the end of old age. Now, we're all going to die. Older people are going to die sooner. And for many of them, it's a problem. And Chiltern Compass is an organization which has been set up to help people meet the challenges of end of life. And we hope it's all done through loving well, living well, and then finally leaving well. We launched in October 2019. And though we'd been doing a bit of work before that, and we took a very big hit from COVID because inevitably we run on meetings, face-to-face contacts, and we had to stop all of that. We did manage to do some Zoom meetings very successfully, we did 3 or 4 Zoom meetings during COVID, which worked well. The problem from my point of view, and I have to say that I am actually in another life, was a geriatrician looking after old people, and we set up an integrated care system in South Buckinghamshire in the mid-90s and the end of the 90s. And we helped people to die at home if that's what they wanted. But what I realized, and what other people working with us realized, was that people weren't prepared to make the decisions that they wanted at the end of life, and something had to be done to help improve that. And so we set up Chiltern Compass to do it. And we hope that we're an inclusive organization, irrespective of creed, color, age. And we say very clearly that there are no right or wrong answers. What we're really concerned with is what matters to you. And we work with people as individuals trying to get the decision that they want to make. And the other thing too is, though we talk about dying, it's actually also all about living. And as in the Snoopy cartoon here in front of you, it says someday we will all die, Snoopy. True, but on all the other days we will not. And one of the things we concentrate on very much is that though people look into the challenges and prepare to meet them, we also try and help them how to live well and have their bucket list and their priorities and what they want to do after that. We tell people that actually talking about dying and death doesn't actually bring it any nearer, and there's no need to be fearful about it all. Evidence has shown very clearly that if people do talk about it and accept the challenges, then they often age much better. They're much less anxious, much less tense about it. And importantly, when they actually do die, the bereavement processes on those who remain are much improved. So we think it's actually very important. Okay, next slide, please. So what's our purpose? So our purpose, as I've said, is to help people manage and come to terms with the issues around end of life, either their own or that of a relative or friend. So it's a very personal thing. We're trying to get people to talk and reflect, and all underpins all we do. And in talking and reflecting, they build networks around them that support them about this, and we hope would strengthen families. I always said that if Chiltern Compass was successful, we'd have a community in which an unmarried mother could move into and say that this is a community I want to live in. So we are very community based. It's very important to us that we emphasize the community aspects. We initially emphasize the practical because people are often fearful, they're worried, they don't like talking about deaths. And if we approach the practical, then we find that that's often a way we can get people to start thinking and talking. It comes much more naturally. And we arrange powers of attorney, and we have contacts, and we have a couple of solicitors actually on our project board. And we have we've talked to people about funeral management, and most importantly about creating bucket lists. We don't provide a counselling service. We don't have any trained counsellors, but we are very happy to talk to individuals and groups as equals about the emotional factors, and particularly the challenges arising from fear. And people talked about the effect COVID's had on older people. And I think a lot of that has been because their fear levels were really risen and hyped up. And that's also true about end of life. Next slide, please. We're also very keen on organ donation. What we find is that the UK and Europe is one of the lowest organ donating nations that there are. And part of that is that the person who is offered to donate their organ hasn't talked to their family, and their family often after their loved one has died, it's the first time they hear about it, and they don't want they don't understand about giving the organ donation. And we think if we can get people to talk, particularly their families, about their own end, and particularly any organ donation they want, and we've had some successes, excuse me, in people giving the donations. We'd like to influence the local culture around end-of-life management, both in primary and secondary care. And as I'll talk in a moment, we've been much less successful than that. A large part of the problems with healthcare at the moment are around end-of-life, dying, and frailty. And we know that many of the admissions to hospital are at the end of life are often unnecessary and only occur because there are no other alternatives to put it in. And we know that the vast majority of healthcare expense is in the last year of life, and that in the last year of life, on average, there are about 3 hospital admissions, which really add very little. If those could be better managed, I'm not saying they should necessarily be all stopped, but if they could be better managed, then it would have an enormous impact on healthcare and about the other issues of inequality that we're trying to address as well. We also want to try and get planning in that is more in advance of the advanced care planning. Advanced care planning often only takes place in hospital, and when death is imminent. And we think that is too stressful a time for people to be thinking about the death issues. And so and end of life issues, and if that could be taking place earlier, then people could actually talk to families and have a much better and calmer dying. We try to network with local organisations such as faith groups, statutory organisations, in all that we try to do as well. Next slide, please. Forgive me, I'm rather rushing through it. One of our great successes is this booklet, which has got about 30 pages in it, with my end-of-life plans. And we've given away hundreds of these to people as a framework around which people can think and decide what they do. Often it's the members of the family that take it and use it, and again, as I say, use it as a skeleton to clothe their ideas of what they want at the end of life. Next slide, please. So what have we achieved? Through our workshops and meetings, we interact with about 600 to 700 people a year. We've talked to a variety of community groups, such as WIs, church groups, and during lockdown, as I said, we did a series of Zoom meetings. In May 22, we ran a major workshop at Missenden Abbey, bringing together palliative care, local doctors, and other charitable to see what innovations were possible. And though it was a very good meeting, we haven't really achieved what I'd hoped we might have done out of it. We have a Facebook group, and I've already talked about our life plan books, which we've given out. And Chiltern Compass has networked with a variety of professional groups, such as hospices, care homes, lawyers, undertakers, and the crematorium staff, amongst others. And we think a very important part of our job is the networking. And we hope out of the networking will come the communities that I think will be supportive towards this. Next slide. But we've not, everything's been successful. We had hoped that we might have a little bit of influence in impact with local strategic bodies and persuade them that it was important to take on end of life planning. And we've done badly with local faith groups, either Church of England or the Muslim groups, all of whom we've approached, and really we are kept hands off distance. Nobody, even in those groups, really want to talk about end of life. We've tried to get involved with integrated care very unsuccessfully. And though we've been to patient groups at surgeries and so on, actually getting the staff involved has actually been very difficult. They don't want to know it. One of the GPs once said to us, "I don't want to be known as Dr. Death." And so that to some extent you can understand it, but I don't think that's excusable. On the other hand, we're enormously grateful to the Heart of Bucks, which stands out a beacon and imaginative supportive help, without which we would have probably fizzled out following COVID. Though they gave us some money, I think it was their support and their good wishes and help for us that actually made us want to go on after COVID. I thank you all very much for listening, and I hope this has been helpful to some of you.
Great stuff. Thank you, Chris. Really appreciate your thoughts on what is obviously a difficult subject to talk about, and probably we as a nation struggle to talk about it the most of any. But I really appreciate your thoughts and your candor. Does anyone have any questions? I appreciate we want to try and get everyone away at 11, but I just wondered if there were any sort of final thoughts from anyone, or if anyone wanted any further information on anything. Please do pop it in the chat. I did have a couple of questions written down that I'd like to ask, but I'm just very conscious of time. Maybe I will just ask one and see how we get on. But if you need to be somewhere at 11, please do feel free to drop off. I thought it was really interesting, Mark and Lucie focusing on isolation in your presentations, and there was a strong thread around isolation in both presentations. We didn't really get to sort of solutions because it's such an issue for people that suffer it. I can see why spending days, weeks, months only talking to the postman for 5 minutes once a week is incredibly sort of crippling for your mental health, and why I think it's such a big issue. What are some of the solutions to isolation? Because it doesn't seem to me that there are immediately obvious things that we can do to support people experiencing extreme isolation in old age. Maybe Lucie, if I come to you first, and then Mark, for a follow up.
Yeah, so one of the challenges with isolation is, by the very nature, who do we know that's isolated? Because they're probably not going to be having contact with a lot of services. So one of the things that we've done pre-COVID, we started looking at isolation, but obviously with the COVID and the pandemic and lockdowns, things significantly changed. So we have developed a social isolation guidance toolkit, but ultimately it is about having conversations, strength-based conversations with individuals to understand, are they isolated or are they lonely? Lonely is a subjective feeling, classic 100, be in a room with 100 people and still feel lonely. Where with isolated, they're not coming into contact with individuals. So it is about having that strength-based conversation to understand what's happening for that individual, but also to work with them to come up with a plan and a solution. So, one size doesn't fit all. So, there isn't necessarily always a service that we can signpost people into, because not everybody will necessarily want a befriending service. Not everybody will necessarily want to go to some of the traditional things. They want to reconnect with friends or family. So it might be a digital solution is needed. But there's certainly a toolkit, and I can send you the link to that for you to have a look at as well. But again, I think it's where it comes into everybody's responsibility to be having those conversations with the people that we come into contact with.
Great, thanks, Lucie. And I suppose as statutory services get more and more squeezed, there's the role of both the charity sector in picking up some of these issues, but also the wider community and some individual responsibility to talk to your neighbours and keep an eye out for all these things. So yeah, thank you. Mark, did you have any comments on that point?
Yeah, and thanks Lucie, for that. I think it's complicated, isn't it? And it's multifaceted. So some notes I've taken down around that: digital connection, digital inclusion, and being able to contact family and friends through things like a smartphone or other forms of communication is something we need to look at. Transport, we've talked about, which is the connection with the local community and be able to get from A to B, to go to groups and meet with people. There's lots of smaller groups around Bucks that are doing great things with lots of volunteers. I mentioned the age concerns, but often they're supported by 10, 20, 30 volunteers with a transport bus, but they need funding. And often we're losing some of those groups and services, particularly after COVID. And so it's really important, I think, that those services which are aimed at older people and help with isolation are maintained and supported. And also we just need to think about that there's the right groups and activities available to suit people. There are a lot of initiatives, but sometimes those initiatives don't suit older people as much as they might do people in their middle age or in their younger age. I think the biggest thing though, Henry, probably is societal. Lucie talks about stereotypes and ageism, and I think we hopefully the age-friendly approach in Bucks that's being followed through the strategy now is going to bring the whole of our society to think differently about what aging is and to sort of be inclusive around older people. And that does start with the individual, but it also starts with the sort of infrastructure and the community that we're creating as a society, which is a much, much bigger issue.
If I can just pop in as well, sorry, just to say as well, I think like Lucie touched on, it depends, the reason is why people are isolated. So if they're isolated because of their, physical frailty or mobility, that brings with it a whole range of other issues. If they're isolated because they live in a very rural area of the county, some of the digital connectivity Mark's talking about doesn't work great in some areas up in the north of Bucks because the signal's not lovely. So we need to, it's a much, much bigger picture, and it's a huge piece of work because it's very labour intensive because it has to be that individual. And just a final thing about people who are very isolated, I always worry about risk and safeguarding, because those people that are very isolated and don't have very much contact, those are the people that sometimes are at bigger risk. And if they're not being supported or they're not being seen, I do worry about their that area of life for them.
Great stuff. Thank you. That's really valuable insight. I think we'll leave it there because we're 5 minutes over, so this is poor chairing on my part. But I'd like to say a massive thank you to our speakers, Chris, Mark, Helen, and of course Lucie at the local authority. I'd encourage you to go and visit their websites, find out more about the work that they're all doing, and we will also circulate our healthy ageing report around to the group today. So on behalf of Heart of Bucks, a massive thank you, and we look forward to seeing you at our next webinar soon. Cheers. Bye bye.
Thanks everybody.
Bye bye.